Today on our show, we have Dr. Lesli Hapak, president of the Ontario Dental Association. Thanks for joining us today, Lesli.
Oh, you're welcome. And thank you for inviting me, Robert.
How are you and your family doing during the pandemic?
Well, so far to date, my husband and myself and our 4 children have been lucky. We have all been healthy so far. So that's a good thing.
Terrific. How has the pandemic affected you and the dental profession?
Well, it's our dental profession has gone through a little bit of a roller coaster ride, I would say, over the last 3 months. Early on in the pandemic, our regulatory body and Public Health Ontario strongly suggested that the dental offices close or shut down, except for those that had appropriate personal protective equipment or PPE to provide emergency-only services. So myself, along with many, many other dentists, closed our practices. We had to lay off our staff, and we donated a lot of personal protective equipment that we did have to the frontline workers. So it's been a little bit challenging. As you know, we're not the only profession or sector that has been affected. But you know, now that we're able to get back into the dental offices, it's going to be a slow go for sure.
Do you foresee any reluctance on, your patients coming to the dentist's office because of COVID-19?
It's hard to say specifically because dental offices just really reopened a week ago. But our national association, like the Canadian Dental Association, had done a survey a few weeks back. And, surprisingly, a lot of patients or a lot of people were ready to come back and go to the dental office to get their treatment, especially if they haven't had, treatment in 12 weeks and things have started to brew and they need to get the care.
Yeah. Are there any new protocols that have been implemented at the doctor's office for everyone's safety?
Yes, as a matter of fact. I will start off by saying that, dentists are leaders in infection and prevention. As recent as 3 years ago, we've updated those protocols that are in place. So, patients can look forward to the same, strong, stringent standards that we've always had. But during the pandemic, we've enhanced some of those protocols. So some of the things that, a person will expect to see when they come into the dental office now is they may be asked to wait outside the dental office and only come in once their appointment time is set. If they are in the waiting area, it's usually limited to maybe 1 or 2 individuals. Patients will likely be asked to put a mask on, hand sanitize. There might be like a plexiglass barrier between them and the front staff. Generally in the waiting area, you likely won't see things like toys, magazines, artwork, and things like that right now while we're in through the pandemic. And once you get back into the actual operatory, depending on the procedure that you will be having done, you may see the dental staff, like the dentist, dental assistant, and dental hygienist have enhanced personal protective equipment, specialized masks, maybe a face shield, things like that.
What's the process for patients returning? Do they call in? Will the dentist office contact them?
Generally, most dental offices are putting plans in place to address that. Generally, what we're saying to patients is we will call and schedule or reschedule appointments. We've had 12 weeks of a backlog now. And we're going to prioritize those individuals that have more severe issues and get them in first. So by all means, if you do have an issue, call the dental office, and that can be arranged and taken care of. But for things like routine checkups and cleanings, those are going to be lower prioritized right now.
Do you think is there a time frame? I guess it depends on the practice on when the dental office has been able to catch up on past appointments.
Yeah, there's nothing really specific. I think a lot of it varies between, what procedures that you may need to have done, whether it's a general dental office or if it's a specialist office like the orthodontist or periodontist or an oral surgeon. So again, we're going to try and get through that backlog as quickly as possible. But because of the enhanced infection protocols that are in place, appointments are going to likely be longer. There will be fewer appointments during the day. So we're not able to see as many patients as we did per day prior to the pandemic. So we're asking, everyone just to have patience and understanding with us while we're trying to play catch up to a certain extent.
You talked about some of the protocols coming in place, and that many of the dentists donated their PPE supplies to the frontline workers. How is the supply for the PPEs for the dental association?
That's been one of our biggest challenges, is trying to get authentic PPE. It's, there is definitely a global shortage, and it's difficult for everyone trying to obtain that personal protective equipment. There's more or less two supply chains. The government is the biggest source of personal protective equipment, but again, even they have challenges with getting authentic PPE. We heard a few weeks back that a good portion of what the government got in was faulty. It was like what we say counterfeit. So, the Ontario Dental Association recently is reaching out to private industry to help us with that. But again, that's the biggest challenge for those procedures that require that specialized PPE.
Well, Lesli, I know that you're local here in our community, and you're also been newly elected as the president of the Ontario Dental Association. How has that been?
It's definitely something that you don't predict is going to happen when you're getting into your year. Over the last 12 weeks, at the leadership, like our board of directors and a lot of our advisory committees have been meeting every week, at least once a week. Another working group committee that I'm on meets 3 times a week. So it's been very, very busy in some respects for me, given that leadership role.
And we also like to end up with a little bit of hope. What are you looking forward to personally when the pandemic is over?
Probably for me, the primary or the biggest thing that I'm looking forward to is being able to see people face to face and have that interaction. Doing things like Skype and Zoom and having meetings like this, through virtual media is great, but there are still some times where you actually need to be in the same room and face to face. And even from, I look at my kids, and they're like, they want to go visit their grandmothers and, give them a hug. And instead of, just kind of waving and saying, "Hi, Grandma, how you doing?" So that's for me personally. From a business perspective, once everything sort of settles down, I think in my office, again, it's being able to interact with patients, a little bit more. I've been in practice or a dentist for almost 30 years, and it's some of my patients who've been longtime patients, like to come in early into the office and chit chat with the front staff, and then we bring them back into the operatory. We have all that nice conversation, how their family and everything is doing. And right now, that's very limited.
Well, Leslie, we really appreciate your time. Congratulations on becoming the president. And once again, thank you, and please stay safe and stay well.
Same to you, Robert.
That was Dr. Lesli Hapak, the president of the Ontario Dental Association.